Welcome back, dear viewers, to Good Morning Kuwait. Now, of course, you all know root canal treatment is often feared, and its reputation is usually harsher than the reality. With modern medical advancements and new technologies, dental treatment has become more comfortable, and saving a natural tooth is now a safe and achievable option in many cases. Today, we'll look at root canal treatment from a different perspective to understand when preserving a tooth is the right choice and when the more difficult medical decision becomes the correct one. With that being said, we welcome Dr. Mohammad Alshammari, endodontist, which is root canal specialist. First, welcome on the show.
Thank you, and I'm really honored to be back again here.
Thank you. So now, like we said in the beginning, root canal is something scary, right? People hear it, al-asab, they're like, okay, no, I gotta avoid it as much as I can. What are the biggest misconceptions a lot of people have about this procedure?
Yeah, most of the people, they have a lot of fear doing root canal treatments because there is a lot of bad misconceptions in the past. In the past, the anesthesia itself was not that efficient. But nowadays, with the current advancement in medicine and current advancements in anesthesia, root canal treatment can be done without any pain and without any fear, and can be done even a single visit in less than 40 to 30 minutes.
Yeah, because, as someone who grew up with older generation who had their, tooth roots have, my memories of them just, lying down by the couches, just holding, a piece of ice. So that I think that's where a lot of misconception come. Now, it's my understanding is that you have, studied abroad and learned abroad to implement it in your practice. Would you like to educate us a little bit more on that aspect?
Yeah, I have studied actually abroad and in Kuwait. And what I found that there is a lot of new techniques, new type of treatments that were not utilized before. And what I'm trying now to do is to more implement my practices and what I have recently learned to the Kuwaiti society, and even not just in Kuwait, even in the GCC where I go and lecture in most of the countries in GCC. And what I'm trying to do is to implement the new advancement and new treatments that have more higher success rate and less painful, and also preserving the natural teeth as long as possible.
MashaAllah. And so when you're talking about adding these enhancements, like I imagine about new technologies implemented in the practice.
Exactly.
So, if you, in your opinion, like what role did these kind of technologies play, and especially advancing these kind of procedures?
Yeah, one of most recent technologies that I have implemented in my clinic was using the microscope.
Okay.
The root canal itself, the nerve that's inside the tooth, it is as small as a human hair.
MashaAllah.
So imagine doing or treating this small little thing with your naked eye. It is really, really difficult. That's why in the past it had a lower success rate. But currently, by using the microscope, we can look better, we can clean better and do better treatment. And also we are using a cone beam CT scan, which is short-term CBCT. CBCT is a 3D imaging of the whole skull and the whole teeth. So in the past, where we used to take a 2D image radiograph, currently we are taking a 3D image radiograph. There is a lot of new technologies that we are using, such as intraoral scanners, digital scans that we take for the teeth, and we look for missing things that the naked eye usually would miss out. So using all of these new technologies have changed dentistry in the past 10 years a lot.
MashaAllah. So do you think that a lot of people, still are afraid of dentists because they don't know that these kind of technologies exist?
Yes, that's why when you compare generations, in the past generations, most of them, they have lost all of their teeth.
Yeah.
And they are using like complete denture that is not fixed, that you move out and in from your mouth. But as you can see with the new generations, most of them, they are retaining their teeth for a longer period of time, with the full set of teeth for a longer period of time. That's what the new concept and new dentistry have changed. So the new generation are less fearful. There is a part that they are still fearing,
Yeah.
because not of the most of the treatments are fully explained or understood. That's what the fear is made from, because people, they don't understand what is the treatment exactly.
It is.
So when you explain everything, everything will become much smoother.
And I think, you know, from my personal friends and family that I know who have gone to the dentist, a lot of people are afraid of making these kind of procedures because it's so close to the mind or the brain, and they are awake. So, and they usually hear everything. I think a lot of them say that's what's scary about it, is that the sound is amplified. So that's why it's scary. But like you said, it's totally safe. Technology is helping it.
Exactly.
There's nothing, you know, to be afraid of.
Yeah, just last night, I had one of patients that she was not actually fearful from the treatment itself, but she hated the sound.
Yeah, the sound.
So now we have AirPods. So she
Mashallah.
placed the AirPods,
Yeah.
and I did the treatment, and it was smoothly finished. And some of the patients that are just, they don't want to sit on the dental chair itself, they have severe dental phobia. Even nowadays, we can do general anesthesia. So general anesthesia, they sleep, okay? We do our treatments, they wake up, and they go back home the same day. So even nowadays, we are utilizing not just the dental chair itself, but we are also utilizing the general anesthesia and doing the whole treatment under general anesthesia without the patient even feeling anything.
Yeah, mashallah, I love that. You know how they say الحلول متوفرة. Yeah, there's a solution for everything.
Yeah.
Now, I do want to ask you about something, is that when it comes to making a very critical decision that sometimes can be difficult, whether it is to treat the tooth or the problem, the root canal, or to, you know, separate or take the tooth entirely.
Yeah.
I know a lot of people would like to avoid the latter option, but, you know, as someone in your position who has to make that kind of difficult decision, like what goes into making that decision?
Well, there is a lot of things that I put in mind, okay? For example, the first thing that I would ask myself, how long will this tooth will be functioning without any pain?
Yeah.
So is it going to function for a short period of time and then the problem will reappear again, or will it stay for more than 5 years? Well, if it's going to stay for a long time, then it's worth saving. But if I'm predicting that this tooth will either fail in the future, or this treatment will not even help with the infection or any pain, then it's better to take out. But for me, I hate saying the word extraction or removing the tooth out.
Yeah.
So I usually tend to keep this option as the last option, unless it is the only and the best option. So there is a Kuwaiti saying, الضرس اللي منه رجل وخلعتها لابد. I don't know how to translate it.
I think that's okay.
But it means that the last option is usually extracting the tooth, which is better than feeling the pain for a long period of time.
I think, you know, as someone who in a patient's position, it's always comforting to know that, you know, the dentist goes through all of the options before they go with the, you know, severing the tooth itself. That's a little bit comforting.
And there is also what we say the cost effective. Well, is the cost of treating the tooth is better than removing the tooth out?
Yeah.
So sometimes I'm saying to the patient, well, you are going to pay like a lot of money for saving a tooth that is not worth that money. So there is another factor, which is the cost effective.
The cost, yeah.
Yeah, is it costly effective to saving this tooth or not? So this is one of the factors that I also keep in mind.
I can't imagine, you know, being in a position where you have to make those kind of decisions on a day-to-day life, you know. I mean, that's another great amount of words, and thankful and gratitude goes to all the people in your position who have to make those decisions. So again, thank you for choosing this kind of field. Now, I do want to ask you about something. We've gone through a little bit of the fears that people have when they go to have procedure done. But when it comes to psychological fears, like, it's not about sounds, it's not about the chair itself, but people are just afraid, patients are just afraid. Like, how do you approach these patients who have psychological anxiety when it comes to having these procedures?
Well, first of all, you need to dig deep on what is exactly the exact fear that they have. Is it just a psychological fear, or let's say dental phobia? Is it from a past experience? Is it because they are having a lot of pain and they don't want to get more pain after getting the treatment done? So it really depends on each type of patient. So what I try to explain is that if you are fearing from the pain itself, well, when you get anesthetized, you will not feel anything. And I'm sure that you will not even feel the injection itself. But if you are fearful from just sitting on the chair, which I see a lot, they don't want to sit on the chair. They know that they have a lot of problems. Well, I say to them, there is another option, which is the general anesthesia. And this is one of the best options, where you can do all of your treatments in a single shot, single visit. You do everything, you treat everything, and that's it, and you go home on the same day. So it really depends on the patient's situation and what is exactly their major problem. I have a lot of patients that came to me asking for general anesthesia, and then I convinced them to do it under the dental chair. Because I can do it, and you're fearing from something that I can have a control on it. But some of them, they don't have any control over their movement or their fear.
Yeah, and you know, I think a lot of those fears and a lot of those anxiety comes because now people consume social media posts about anything.
Yes.
And you know, in your field, I'd imagine people showering social media posts, even if it has misinformation or whatever, and you have to deal with that on a daily basis. So as someone who has to go into the dangers of social media to correct people, like how do you balance that equation? Is that you have to give them the proper information, but you have to also make it short, you have to make it sweet, you have to make it concise, you know.
Yeah, I'm trying, and well, I see a lot of patients that come to my clinic, and they have a lot of misconception, especially from social media and from these short videos that are generated by AI, and you don't know what is exactly the source of the information. What I try to do is I either try to educate the general population in my social accounts with short videos, explaining to them things that's not fully understood, and I try to explain to them in my clinic. For example, the other day I had one of my patients that came to me. They want to change their amalgam fillings or the silver fillings. Why? Because they saw a video on one of the social media platforms that said that they need to take them off. I explained to her that it's not really need to be done unless there is a problem. Okay. So yeah, I see this a lot, and I try to explain it to my patients in an easier way so they can understand it very well.
It is, and it's a problem everywhere because, you know, several of my family members who are in the medical field, they say if we can eliminate one problem is people don't use ChatGPT.
Yes.
And even like the makers of that website said, don't take it for medical advice because it's basically a searching thing, but people just walk into everywhere. With that being said, Dr. Mohammad Alshammari, I do want to thank you because we unfortunately have ran out of time. So I want to thank you for dedicating the time out of your day to come here, you know, talk to us, educate us all about the root canal and all the processes that goes with it.
I'm really welcome, and I'm really happy to come and share, and we are trying both to educate the whole population in Kuwait and try to educate them with their oral health.
It is, yeah, and we'd also like to thank you again for dedicating the time to bring awareness to these issues. But also, we'd also like to thank you, the viewers, for staying tuned. We're going to take a break, so stay tuned after this one.